Welcome back. It is estimated that nearly 80% of adults suffer from back pain during their lifetime. Many suffer from this chronic debilitating pain because of their fear of back surgery. Today, a team of innovative and compassionate doctors led by world-renowned spine surgeon Dr. Anthony Yeung are changing the way we look at spine surgery, one patient at a time.
When I was a resident, my mother, who was a small woman, had a central disc herniation with canal stenosis. She underwent traditional surgery that actually caused her spine to be unstable. At the same time, I felt responsible to find something that is more effective, safer, less invasive to treat her condition. Now I believe I found that. I wanted to devise a minimally invasive method to treat back pain without causing any damage to normal tissue. The old way, you always had to strip muscle, you always had to remove bone, and you always are worried about scar tissue that you cause next to sensitive nerves that cause pain, even if you do a perfect job.
The y.e.s.s selective endoscopic discectomy is a minimally invasive technique for spine surgery developed by Dr. Anthony Yeung. The procedure utilizes a specially designed endoscope. It's performed on an outpatient basis and doesn't require general anesthesia.
We have probably the most comprehensive approach of any spine group in the country, and we offer less invasive, the least invasive methods to diagnose and treat the pain. And even when fusion or the big surgeries are appropriate, there are some patients that are too sick, have too high a comorbidity, or they simply don't want to have the big surgery. They don't want to be put to sleep, or they don't want to have anything cut open. They don't want scar tissue. Then they will opt to have a less invasive procedure first. Three basic things that I do. Decompress, meaning if a nerve is being pressed on, it'll cause numbness and weakness. Ablate, I kill the nerve that causes pain if it's not needed. Irrigate, I wash out the areas that have pain because pain is caused by inflammation. If you just have pressure, you have weakness and numbness. But you add inflammation, you have pain. So those three simple things, decompress, ablate, and irrigate, identifying where the pain's coming from. It took me 20 years to figure this out. And now, as I do more and more, it's more and more validated. And it can be done with a minimally invasive technique with a little incision with a needle and a laser or a radiofrequency probe. Good thing about this is I come in from an area that does not cause any scar tissue, does not cause any damage, so that the patient still has traditional techniques available to them if they need more. It's a philosophy and it's a technique. So a philosophy based on science, but also the art of identifying where people hurt, and more importantly, if they hurt, whether they are realistic enough to accept what can be done. I'm particularly proud of the fact that in the past 5 years, since my son joined me and since we added Dr. Field, we can offer the full spectrum of spine care for painful degenerative conditions of the lumbar spine.
We can offer the patient so many more options, treatment options for their back and leg symptoms and also their cervical symptoms. We really treat the whole spectrum of spine conditions. So here at DISC, we really try to identify the pain generators before offering treatment options. So some of the biggest problems with spine treatments are that people are treating x-rays or MRIs and they're not really listening to the patient and seeing what the actual complaints are. A lot of times patients come to us in a lot of pain and they think they need surgery. They're almost begging for surgery, and we have to talk patients into trying other treatments, because a lot of times, even though they're in a lot of pain and they feel like they need surgery, they'll get better with physical therapy, some anti-inflammatory medications, some steroid injections potentially, and a lot of times we can avoid surgery.
Dr. Yeung has given me a second chance for another youth, because he's worked with me through this whole process, and it's so frustrating. There's so much pain that's involved with it from time to time. You just want to just go, let's do it and get it over with, but he's always got that calm demeanor. He's very watchful, and it's hard to find physicians that are that way, but they're out there. You just have to be diligent about it, and I was very fortunate to find Dr. Chris. I mean, I'm going to call him Dr. Chris because he's Dr. Chris to me.
People with chronic back pain know that their condition not only affects themselves, but those around them as well. With more on the subject, here is Dr. Justin Field.
Certainly, we see patients every week that have neck pain, have back pain, and certainly you can, relate the pain they have to, the MRI findings, and they may have a herniated disc, and you can explain to them why they may have numbness or may have some weakness, but really what's bringing the patient in to see us is the fact that this pain is affecting their quality of life, their activities of daily living, not only their job, but their interactions they have with family members, with their spouse, with their children. And I think, one of the sadder things that you'll hear from patients is, when they can't pick up their own child.
As I started moving around and seeing both of my sons come up to me and say, Daddy, you can walk again, it doesn't hurt, doctor fixed you. It brought me to tears, but two, just the euphoria of having that and knowing that now my children know that I'm okay. As a father, it's a wonderful feeling to have.
You notice after a while that your enjoyment of life kind of goes away, and you're trying to maintain family and social and friends, and it kind of stops. Your life stops. You do what you can do to just get through your day. What they did to me, it is nothing short of a miracle. I interviewed another surgeon at a renowned facility in Phoenix. What he wanted to do was just so far over the top of what I could comprehend for my age. When I spoke to Dr. Field about it, he said, oh no, we don't need to do that. Talked about what he could do and what I'd have to do to maximize the results, and it was all something I was really willing to do to get a new life. It's a miracle. I'd do it again. I'd do it again.
We can offer patients things they can't get anywhere else. For instance, we are very active in research and participate in many FDA studies, and in doing so, we get to offer these new treatments to patients about 5 years before any other spine surgeons.
We are the only group in the country that can do our own diagnostic injections, our therapeutic injections, and minimally invasive surgery the way I do it. Patients benefit by having the widest spectrum of choices.